Welcome to the monthly podcast presented by JAMA Health Forum. I'm Dr. John Ayanian, the director of the Institute for Healthcare Policy and Innovation at the University of Michigan and the editor of JAMA Health Forum.
And I'm Dr. Melinda Buntin, Bloomberg Distinguished Professor of Health Policy and Economics at Johns Hopkins University and the deputy editor of JAMA Health Forum. JAMA Health Forum is a peer-reviewed, open-access online journal focused on health policy, healthcare systems, and population health, and one of 12 specialty journals in the JAMA network. Our podcast each month presents highlights of new content from the journal, including timely interviews with authors of research studies and commentaries. Follow us on jamahealthforum.com, on Apple Podcasts, or wherever you get your multimedia, and on jamanetworkaudio.com.
Our guest author today is Dr. Rishi Wadhera. Dr. Wadhera is Associate Professor of Medicine at Harvard Medical School. He's also Section Head of Health Policy and Equity Research at the Smith Center for Outcomes Research in Cardiology and a practicing cardiologist at Beth Israel Deaconess Medical Center. Dr. Wadhera is the corresponding author of a new study in JAMA Health Forum titled Changes in Healthcare Access and Preventive Health Screenings by Race and Ethnicity in the United States, conducted with colleagues Christopher Alba and Xiaonian Zhang. Rishi, you're one of the first authors that we've had back for an encore interview on the JAMA Health Forum podcast since we spoke with you in July of 2022 about your study of safety net hospitals and value-based payment programs. Welcome back to the podcast.
Thank you so much both for having me back on the podcast.
So fun to talk to you again. So Rishi, the opening sentence of your article refers to the, quote, unprecedented disruptions to healthcare related to the COVID-19 pandemic. Can you tell us more about the specific motivation for your new study that you've published in JAMA Health Forum?
So during the first few months of the COVID-19 pandemic in mid-2020, there were enormous disruptions in healthcare services across the country. And those disruptions were driven by a combination of things. Stay-at-home orders were initially in place while we grappled with how to deal with this public health crisis. Many outpatient clinics stopped seeing patients in person to mitigate the spread of COVID-19. And healthcare systems experienced really significant strain due to the surging number of COVID-19 hospitalizations, which made it challenging to care for patients with other medical conditions. And so, unsurprisingly, during this really, really acute period of the pandemic in 2020, many adults weren't able to access important preventative health screenings, whether it was for diabetes or mammogram for breast cancer. And so for this study, we really wanted to understand whether healthcare access and preventative health screenings bounce back, so to speak, in 2021 and 2022 when things were starting to improve from a pandemic perspective.
Thanks for that framing. What were the three main questions that your study was designed to address, and what data did you use to answer those questions?
The first main question that we aimed to answer was, how did measures of healthcare access change as the pandemic went on in 2021 and 2022, both overall and across racial and ethnic subgroups? In addition, another major goal of the study was to determine whether this precipitous drop in preventative healthcare screenings that had been documented in 2020 bounced back in 2021 to levels that had been observed prior to the pandemic. And we specifically focused on screenings for common chronic conditions like hypertension or high cholesterol and diabetes, and also for different types of cancers like breast cancer, colorectal cancer, cervical cancer. And again, we focused on changes both overall in the U.S. adult population, as well as by race and ethnicity. And the final goal of our study was really to understand whether changes in socioeconomic factors like income, employment status, insurance coverage contributed to any changes that we observed in healthcare access and preventative health screenings. And to answer these questions, we used the National Health Interview Survey, which is a nationally representative household survey of U.S. adults, which is conducted by the CDC and National Center for Health Statistics.
Thanks. And can you fill us in on the main findings of your study and whether or not any of those findings surprised you?
Our first key finding was that outpatient wellness visits amongst US adults were lower in both 2021 and 2022 compared to rates observed just before the pandemic in 2019. And I think one thing that surprised us was that this decline in wellness visits, though we observed it in the overall US population, it was largely driven by a big decline in outpatient visits amongst Asian adults specifically. Our second key finding was that preventative health screenings for hypertension, high cholesterol, and diabetes remained lower in 2021, again during the pandemic, compared with pre-pandemic levels in 2019. And these lower rates were generally observed across all racial and ethnic groups, although again, the biggest drop in screenings were generally seen in the Asian subpopulation. And a third key finding of the study was that cancer screening rates among eligible US adults remained lower in 2021, again during the pandemic, compared with 2019, just prior to the pandemic. And again, Asian adults generally experienced the biggest drops across all types of cancer screenings. In addition, Black adults experienced large declines in colorectal cancer screening, while Hispanic adults experienced big declines in breast cancer screening. In contrast, white adults generally experienced the smallest declines across all the different types of cancer screenings that we studied. And importantly, all of the changes we observed in healthcare access and preventative screenings persisted even after adjusting for socioeconomic factors like income, employment, and coverage.
So, what do you think was driving the changes, in particular for Asian individuals experiencing such large reductions in their use of preventive services?
I think taking a step back and broadly speaking, the persistent declines in preventative health screenings are probably due to the fact that many patients got lost to follow-up. During the pandemic, they lost touch with their healthcare providers. There was something that we certainly have seen firsthand is there was this residual fear in 2021 and 2022 that coming into an outpatient setting or a hospital setting might result in being exposed to COVID-19. And so there was some fear, I think, that was also driving delays and deferrals in preventative health screenings as the pandemic went on. You know, I have to say the Asian subpopulation findings, the fact that this was a subgroup that experienced the biggest drops across most preventative health screenings was really surprising to us. But if you look at the literature, the Asian subpopulation, even before the pandemic, tended to have the lowest baseline rates of screenings. And we often talk about Asian adults as a monolith, but Asians represent a highly diverse group of individuals, cultures, languages, dialects, whether that be Chinese Americans, Filipino Americans, Indian Americans, Korean Americans, amongst many others. And so it's possible that some of these subgroups experience unique barriers when it came to obtaining health screenings, whether it be related to language barriers, diverse cultural perceptions about the value of screenings, use of alternative medicine, or again, just fear of coming to an outpatient clinic due to concerns about contracting COVID-19. But ultimately, I'll say that I think this is a really important area that's ripe for qualitative and mixed methods research to really better understand what drove the big drops in preventative screenings amongst Asian Americans, especially if we're thinking forward about what are the potential interventions that we could develop to help address this.
Thanks, Rishi. That's a good bridge to our next question, which is, what are the implications of your study for public health and healthcare, and how can policymakers, health system leaders, and clinicians respond to your study findings?
All of us know that the direct effects of the pandemic were catastrophic, especially in 2020, when the first surges started happening in the United States. But now we're a few years out and we're starting to see evidence of the persistent negative spillover effects of the pandemic on preventative health screenings for chronic conditions and cancer, which could have far-reaching and devastating consequences over the long term, particularly for racial and ethnic minority groups that have disproportionately experienced declines in preventative health screenings. So in terms of what we can do, I mean, I really think it requires multifaceted efforts and interventions. I think in the clinical community, we need to do a better job and be proactive about reaching out to our patients who've been lost to follow-up, who we haven't seen in a while as a consequence of the pandemic, to ensure that they remain up to date on routine care. I think that health systems need to invest in and prioritize outreach efforts in their local communities to increase health screenings, including leading initiatives to go out into socially vulnerable neighborhoods and perform routine screenings like blood pressure checks. And from a public health and policy standpoint, I really do think that now is the time for dedicated campaigns and messaging at the local, state, and federal levels that reach individuals from diverse backgrounds and really encourage them to come in and stay up to date on preventative health screenings, whether it be for diabetes or colon cancer.
Thanks so much. That's a really great policy implication. And speaking about policy, when we last spoke with you on the podcast in mid-2022, we asked you about the biggest change in health policy that you expected to see over the next 5 years. And at that time, you actually were focused on the topic of this study, what you called the tsunami of acute and chronic illness due to disruptions or deferred care that occurred during the pandemic. And you also noted the need for a greater focus on health equity. So in light of your new study and what you're seeing as a practicing cardiologist, how do you think the U.S. is doing in addressing the pandemic-related disruptions and deferred care that you described in our podcast almost 2 years ago?
Well, I apologize for having such a pessimistic outlook in 2022. I'm afraid that I'm still a little pessimistic, and that's partly due to the fact that in the hospital, we have very much, I think, over the last year and a half, seen a surge of patients coming in with medical issues or more severe forms of disease that are very clearly a direct manifestation of deferred care or avoided care during the pandemic. And I'm most worried about the declines in cancer screenings that we observed in our study that persisted even through the end of 2021, as I think we're only going to start to see the consequences of those missed screenings in the coming years in the form of new cancer diagnoses, as well as the consequences of missed screenings for diabetes and high cholesterol in the form of new acute cardiovascular conditions like heart attacks and strokes and heart failure. I think looking forward, I'm optimistic about the fact that there's a lot of growing recognition amongst clinicians, public health officials, and policymakers about this issue, and that we do still have an opportunity to mitigate a potential tsunami of chronic conditions over the coming years if we're proactive about enacting clinical health system and public health campaigns, initiatives, and interventions that encourage patients to get their preventative health screenings.
Well, we appreciate your realistic and optimistic perspective on how our country's grappling with the consequences of the pandemic. Thanks to our guest author, Dr. Rishi Wadhera at Harvard Medical School and Beth Israel Deaconess Medical Center. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.